So here, so many other classifications we can see. So it depends upon the involvement of the cell, tissue origin, and also what type of the malignant, is it malignant or benign tumors. So for example, if you see the classifications, the tissue origin and also benign tumors, what we are going to call, and in the malignant tumors, what we are going to call. So for example, squamous epithelium involvement. In the squamous epithelium, so here in the benign, if it is involvement in a squamous epithelium, in the benign tumors we call as squamous cell papilloma. The same if it is the malignant, that means if it spread to the other parts of the body, it is called as squamous cell carcinoma. Same is there is a oma is there, but we are going to add the carcinoma for the malignant one. The same thing is the transitional epithelium. So is going to the transitional cell papilloma and transitional cell carcinoma. Glandular epithelium we call as adenoma and also adenocarcinoma. So this tissue is going to be different and involvement, the name is going to be different. So that is the difference between the nomenclature, the name in the benign tumor as well as the malignant tumor. And also coming to the involvement of the basal cell layer of the skin, so is going to be the basal cell carcinoma. And also is a neuroectoderm, we call as the benign tumors and nevus, and also melanoma, skin cancers. And also hepatocytes, liver cell adenoma, and hepatoma. Hepatoma means like in the cancer cell in the malignant in the liver. And also placenta is a chorionic epithelium. So if the placenta involvement, so we called as hydatidiform mole and also choriocarcinoma. So these are the different names, involvement of the different structure of the tissue, different type of the tissue involvement. So in case of like a adipose tissue, we call as the lipoma. Adipose tissue, that's a fat tissue. And also liposarcoma. Sarcoma means it's the cancerous. And also adult fibrous tissue, fibroma, fibrosarcoma. So if it is fibroma in the tissue, in the breast or maybe ovaries, it won't spread to the other parts of the body. It's going to come. But here sarcoma may spread to the other parts of the body. So may chance to get the other complications. This next one is the fibronic fibrous tissue, myxoma, myxosarcoma. So oma is there, here sarcoma is there. So it's going to be the cancerous one. So cartilage is going to be chondroma, chondrosarcoma. Bone, osteoma, osteosarcoma. Synovium, synovium, and also synovial sarcoma. So here is a smooth muscle is going to be a leiomyoma and also leiomyosarcoma. Embryonic fibrous tissue is a rhabdomyoma and sarcoma. Same is going to be added. So if you see the name itself, we can understand. So is it the cancerous cell or is it the benign cancer? Like that, so many different type of there is a meso is a from the non-epithelium. So it's a mesenchymal tumors. So mesothelium is going to be mesothelioma, and blood vessel angioma, say hemangioma, and also angiosarcoma. Lymph vessel lymphangioma and lymphangioma sarcoma. The glomus is the glomus tumor, and also meninges is meningioma or is the invasive meningioma. So this also, if it we had the name will be different. Is a hepatopoietic cells is going to be the leukemias, is a cancerous one, is malignant. Lymphoid tissue is a pseudolymphoma, malignant lymphomas. The nerve sheath is going to be the neurolemoma and also neurofibroma and neurogenic sarcoma. Nerve cells are going to be ganglioneuroma and ganglioblastoma. So this is sarcoma, carcinoma, blastoma. Related these terms, these names are related to the malignant type of the cancers. And also, if you see the other classifications, the mixed tumors are going to be salivary glands, is a pleomorphic adenoma, that is a malignant mixed salivary tumors. And next about the tumor of the more than one germ layers. So it's going to be the totipotent cells in the gonads or in the embryonal rests. So this one is going to mature teratoma and also immature teratoma. So this is going to be especially for the ovaries and testes may chance to get this one. So it's going to be a benign and malignant. So these are so many different type of the classifications. So and also different type of the names we can observe and also while assessing the patients. So according to the patients, so if you give the proper investigation procedures and also the biomarkers of the tumor biomarkers, so we are going to identify the what type of the tumor. So if you give the treatment according to tumor, the radiation therapy or chemotherapy and surgical management, so depends upon the causative factors. So if you remove it, we can prevent the seriousness and also we can prevent the mortality and we can give the rehabilitations. So that means we are going to bring back them to normal if we clear the abnormal cell. So that's all about the today's topic about the tumor classification. what are the tumors, what are the different type of the tumors, and also how the tumor nomenclature is there, what is the difference between the benign tumor and also malignant tumor, and also normal cell and also cancer cell. So we discuss now. In the next class, we are going to discuss about what are the characteristics of the tumor, and also what are the next to the stages, and also about the gradings, and also what are the staging and the tumors we will discuss in the next class. Hope you understand in this class. If you have any doubts, you can send me a message. In the next class, we discuss about the characteristics of the tumors, and also grading of the tumors, and also stages of the tumors. We will discuss in the next class. Thank you very much. See you in the next class.